Welcome to another TRT Q&A with me, Paolo Brocardo. That's how you say my name. Today's question comes from Arborn27 and he asks, do you simply plan on never having kids? Doesn't being on TRT lead to permanent infertility? Okay. So that's a very good question. So let's start with, do I plan on having kids one day? Yes, I do. Right? Something that I want to have. And it's also something that the doctors and the endocrinologists have asked me while I've been on TRT. I think they were trying to use it as ammunition not to give me TRT, but I did the tests with them. So previously I had been on TRT, then I went off. I was off TRT for about 6 months and they tested my sperm. And they also, they test your testicle size, they test your sperm, all of that kind of stuff. There's nothing more awkward than a little Indian man cupping your balls. Let me assure you that. Anyway, so they tested my sperm and it came back as normal. So I was quite happy about that. So even though I'd been on TRT for 4 years, we did the tests. I'd been off TRT for 6 months. They did the test on my sperm and it came back as normal. So there was no problem there. But let's get your question, and that is whether it can lead to permanent infertility. Well, I did a bit of research on this, and I know that research is still currently being done on using testosterone as a form of male sterilization or keeping men infertile, so that as sort of like a male contraception, right? There's definitely studies going on about that and looking into that. And from what the doctors have told me and from what I've read, it obviously can decrease your testicle size and sort of decrease the potency of your sperm when you go on TRT, right? That's why they have drugs like HCG, which guys can take if they are worried about not being able to have kids. They give you this drug when you have TRT. I think it also stops your balls from shrinking, and it's supposed to keep your sperm cells strength and your sperm count high so that you can still have kids while you're on TRT. So I'm pretty sure, and this is obviously just based on my own personal experience, if you go off TRT treatment, that there is a chance that your sort of sperm can recover and that it can go back to normal, right? Now, don't take my word for that. I've tried to look this up and I found very sort of limited information on this, but obviously there's a variety of factors that can play into it. Like if you stop TRT treatment like you did at my age at 36, maybe you're still young and healthy enough that your sperm count can increase naturally, right? But maybe if you're on TRT at like 60 or 70 or 80 and you do that, it just doesn't recover. I'm not quite sure myself, but this is just from what I've read. So yeah, so I'm not sure. Like obviously if you're on TRT, then at that point, you can lower your sperm count. But if you come off, I don't know, the ball's in the air on this one. Maybe other guys can give us feedback on this, because from what I've read, it can go back to normal levels. Obviously, it depends on each of the situations. So really, that's all I have to say on the topic. For me, it's working right now when I'm on TRT, that my sperm count is weaker, although I wouldn't count on that as a contraceptive. Wink, wink. Take extra precaution, because you don't want to count on it and then something goes wrong. So yeah, thanks for the question, and I will see you guys in the next TRT Q&A video.